Welcome everybody to the Safety Planning with Survivors of Domestic and Sexual Violence webinar put on by the National Alliance for Safe Housing. My name is Jenny Herget and I'm the TA coordinator for NASH, and I'll be helping to moderate this webinar today. We also have Alicia and Anna from NPJ FCJ who are hosting the webinar today, and Kris Billhardt who's going to be presenting for us on the line. Just a few things to take care of before we get started. You'll see on the right-hand side of your screen there's a chat box, and that chat box is publicly viewable to everybody, so make sure that whatever you say in there is not confidential information. We'll be using any questions or comments that come up in the chat for a Q&A that'll take place at the end of today's webinar. So we'll reserve about 15 minutes at the end, so make sure that you ask all of your questions and we'll compile them for you. We will be sending out a recording of today's webinar along with some of the resources that Kris mentions today and an evaluation. So we really look forward to getting your feedback. And with all of that said, I'll go ahead and let Kris get started. Thank you.
Okay, thanks Jenny, and welcome everybody to today's webinar on safety planning with survivors. I am Kris Billhardt and I'm NASH's technical assistant specialist. I've also been in the domestic and sexual violence field working as an advocate and in various other capacities for a number of years, so hopefully I'll be able to answer questions that you might have about today's material. Today I wanted to make sure that folks know that we're focusing on how homeless and housing providers and agencies can strengthen their ability to discuss safety with survivors that are participating in their programs. And all of this happens, of course, within your COC's system-level protocols around survivor safety. That's another webinar and another resource. And if you have questions about HUD's coordinated entry requirements, we ask that you type them in the chat box and we'll be sure to point you to some resources that will help. And that's true for any questions that might come up today. If they're outside of the scope of today's presentation, we'll still make sure that we get the right information to you, or at least some leads about how to get started with finding that. Okay, changing the slide. Let's see, here we go. Yes. Okay, so as you know, this webinar, as Jenny said, is provided by the National Alliance for Safe Housing, NASH. And for those of you who may be new to NASH, here's just a little bit about us. We are a project of DASH, the District Alliance for Safe Housing, which is a local, safe, and very innovative housing program in Washington, D.C. We have been a national technical assistance and training provider for a little over 3 years now. We were launched in 2015. Our project partners are the wonderful Washington State Coalition Against Domestic Violence. Many of you may have seen some of their resources on DV Housing First and many other things. And then the wonderful District of Columbia Coalition Against Domestic Violence, which is a wonderful partner to have in our work as well. And NASH is part of the Federal Domestic Violence and Housing Technical Assistance Consortium, DVH-TAC, and actually we're adding a sexual assault provider to that consortium as well, and as well as trafficking experts. So we are going to be expanding the scope of what we're looking at as part of the consortium, and I will tell you more about the consortium later in the presentation so we can start digging in. Okay, and NASH, our logo didn't show up there, but I'll just tell you a little bit more about our primary mission. As we're doing today with this webinar, NASH really is all about trying to help communities to work towards increasing the housing options available to survivors of domestic violence and sexual violence so that they can avoid homelessness in their attempts to live safely. Okay, starting off with a simple definition. Safety plan is a survivor's unique strategy designed to reduce the risks generated by a partner's or offender's abuse and control. And there are two unique, very key messages woven into this definition. One is that it's the survivor's plan, and it's very individualized and very much defined by the survivor and how they see being safe as possible. And also that the safety plan doesn't and can't guarantee safety. So you can't be complacent and think, oh, we've done a safety plan, all is well. Even the best plan can't control an abuser's choices. It only reduces the abuser's opportunity to reassault or reoffend or cause harm. So that's an important caveat to keep in mind. Okay, now safety planning, the concept of safety planning has always been a core element for domestic and sexual violence advocates, but it's really clear that homeless and housing providers need to embrace it as well. So it's not just for DV and SA programs anymore. Here's some of why that is. If some of you are not yet familiar with the intersection between domestic and sexual violence and homelessness, here's just some of the facts that we can share with you. 80% of women and children experiencing homelessness have experienced domestic violence. Half of sexual assaults take place within a mile of the victim's home. And this signifies that they may really need to relocate because home may not be safe anymore. The other thing about sexual assault as well as domestic violence is that the trauma impacts can really compromise survivors' ability to retain their housing in the aftermath of an assault or in the context of domestic violence. So that intersection is pretty clear. We know that leaving domestic violence relationships often heightens the danger. It can be an even more dangerous time than staying, believe it or not. So it's really important to be tuned into safety for that reason. And then we also know that just kind of like a fire drill, talking through a plan helps to identify what the high-risk situation that a survivor might be facing and also provide opportunities to brainstorm around what might mitigate the danger. It really promotes survivors' ability to more fully participate in your program and work towards housing goals with that safety plan in place. Here's just some of the fine print. Domestic and sexual violence advocates usually conduct a very comprehensive lethality assessment in conjunction with doing safety planning. This kind of assessment is best left to victim services experts unless you're fully trained in that. That's not what we're talking about here today. We're talking about equipping yourself or your program staff to discuss safety as it revolves around survivors' participation in your services, and as well as to provide referrals to domestic and sexual violence programs for more in-depth planning. So what do we mean by working together safely? Here are some examples of some of the elements of working together that are important to keep in mind as we talk today. These are things you'll need to be thinking about and talking over with survivors that if you don't have that domestic and sexual violence lens, it may not feel material to talk to somebody about these kinds of things. Information sharing that you'll need to do, that's an important piece of information for any new participant to have, but in particular with domestic and sexual violence survivors, knowing where their information is being kept, who might be having access to it, can really help them identify what some of the risky areas might be around that and talk it over and make a plan with you. The safety of a housing location. Is it close to where the abuser might be, or family or friends of the abuser? So that's an element to think about when you're citing a housing unit for someone. Safety connected to visits and appointments. Can they arrive safely? Can they leave safely? If you're meeting them out in the field or at community partners' offices, is that a safe way to connect, and what kinds of elements must be in place to make sure that that's as safe as possible? Is it safe to leave phone messages? Is it safe to send texts? Does the abuser have the password that allows them to find out what somebody is up to as they're trying to make plans to be working with you in your program? How does the survivor want you to handle if you're seen by somebody that they know during the course of services? This could be in your program offices. It could be out in the community somewhere. What kind of plan do the two of you need to make about that relationship that you have, your working relationship being discovered by somebody that they might know? And then advocating with landlords. This is something that's really part and parcel of a lot of what homeless and housing providers and domestic and sexual violence advocates are doing now as we work with survivors specifically for housing. Should you disclose the domestic violence to help explain the rental history? Sometimes that can be really helpful to be able to provide some context to a skeptical landlord about housing history that looks a little sketchy. And, that might sometimes help the landlord open up to taking a chance on someone with a less than stellar rental history. But that kind of exposure and is not always welcome or helpful to the survivor. So that's a really important thing to talk about as you work together, as you begin working together and have an understanding about. Now let's focus in on policy and practice and effective approaches. The goal here would be for all homeless and housing programs to take a thorough look at whether the intent to promote safety is really fully aligned and incorporated with how the agency enacts its services. It's important to convey your priority and your focus on safety really early in your contact with survivors. It's really your first opportunity. What you talk about and how sends lots of messages to people. Information is power. Being transparent and providing clear information about how things work can really help settle someone who may be dealing with trauma impacts, bad experiences with systems, and just daily unpredictability when you're living in a place of crisis. So explain what your obligations are, along with explaining the options. And when there is a disclosure or indication of domestic or sexual violence, to start talking safety. So what are the options around sharing personally identifying information? Making sure that folks know that they don't have to provide the answers to all the questions you might be asking, but being clear about the kind of information that you must ask because you're a HUD grantee. So open disclosure at the very start can help people make informed choices. So your commitment to safety is also conveyed in how you do things, not just what you say, but also how you do it. And how you say it. Assessment, as I'm sure many of you know, is really a two-way process, right? Survivors are assessing how much they can trust. At the same time we're delving into our assessments, they're assessing us. How much can they trust? How safe are they with you? And here are some of the basic best practices that can sometimes be challenging, but might make a real crucial difference as survivors assess whether or not to disclose, how much to share about the context of their reasons for seeking help, etc. So looking at your physical space, is this a place where you're conducting your intakes? Is this a place where you would share something personal and private that you don't disclose to just everybody? So think about how you might be able to adjust that space so that it is a place where privacy is a little bit more obvious to people that are entering into that space. Conducting separate interviews with couples as a matter of protocol can allow you to have that one-on-one time with somebody who might be surviving domestic or sexual violence. And you can certainly, we'll say this more than once today, consult with your local domestic violence and sexual assault experts for help in sorting out power dynamics and trying to figure out how to do that well. And also, again, we don't want you to necessarily take on a full-out comprehensive lethality assessment, but a brief risk assessment at the front end of your intake process as a matter of protocol with everyone that you work with is a good practice to take on. Okay, and understanding trauma and trauma-informed approaches is also a whole other webinar. But we do need to touch on it and have it kind of as foundation to what we're talking about today, because it's a huge part of working effectively with domestic and sexual violence survivors. So here's just some of what we know about trauma, and I hope you will seek deeper training and further information about trauma if you haven't already incorporated that in your work. We know that trauma is extremely pervasive, and it kind of shows up in every realm of someone's life. And so it's going to show up with somebody as they come into services, obviously. It also can have differential impacts on participants in your program who are from marginalized communities, who are particularly vulnerable, and that's important to keep in mind too. It may also recur within families and across several generations, and within communities and families across several generations. You've probably heard this referred to as historical trauma. When there's historical trauma and there's present day ongoing oppression, you can bet that trauma is having an impact in the way somebody's life is feeling for them and how they're operating within that. It's also important to keep in mind that as well-intentioned as all of us in the social services are, the service system has sometimes been re-traumatizing to people who are seeking help and having bad experiences. So remembering that you may not be the first human services person that your participant is encountering, and they may have had bad experiences that they're bringing with them and that cause some distrust or skepticism. The trauma affects how people approach services, and that's a really important thing to keep in mind and keep that trauma lens on. Okay, kind of hearing some background noise, so I'm wondering if someone maybe could mute themselves so that we're not all hearing that. That would be awesome. Okay, so domestic violence and trauma is really extensive and it's really enduring. And we know from a 2013 SAMHSA report, so the Substance Abuse and Mental Health Services Administration, SAMHSA, that high rates of violence and violent histories are found in women seeking support from the entire spectrum of public health services, including safe housing and supported housing. And while the focus of the report was on women, these issues can't be discussed without also considering the impact of trauma on men and other genders. So keeping that in mind, that it's just very, very likely that people you're encountering have a history of violence. We also know that domestic violence is overwhelming, and it can be a life-threatening experience. It creates, and many of the other sources of trauma as well, create toxic levels of stress that result in all kinds of ways that somebody might see the world and respond to the world and communicate, etc., which we'll talk about in a second. In a study that we did here in Portland, Oregon, called the SHARE study, which was looking at almost 300 domestic violence survivors that we were working with in various ways to help with housing issues. In that population, over 94% experienced PTSD, and the average score was equal or higher than that of returning veterans of combat. So it's considerably high. And we also know that trauma can really affect a sense of power or empowerment, how well you believe you can get things done in your life, and your sense of well-being. All those things get very diminished, and this affects many, many areas of somebody's life. In terms of how coping with the impacts of trauma may show up in someone's behavior, what you might see, this is just a partial list, and I really want to encourage you as you kind of look over this list to think about times of crisis in your own life. You may recognize some of your own experiences or behaviors on this list. So difficulty sleeping, having it come out in your body with pain or illness, feeling hypervigilant, not being able to concentrate, sometimes just checking out, difficulty with complex directions. All of those things may have been part of your behavior when you were in a traumatic situation or a crisis situation. So keep that in mind when you're sitting across from somebody who's coming in to seek services in your agency. So it's not news to you, I know, that that many of the people who seek your help are dealing with the impacts of trauma, as we're saying. With victims of domestic and sexual violence, it's pretty much a sure thing. So if you haven't already, it's critical that you step back and examine everything you do as to whether it aligns with a trauma-informed approach. And again, this is a place where putting yourself in somebody else's circumstances can really help. So if you were going through your own intake process, how would you experience that if you were in crisis? Is it a very rushed affair? Is it very obviously focused on a goal, finishing the paperwork? Does it ask a lot of very detailed and intrusive questions that might be very hard to get into because it's very private and intimate? When you're doing your intake process, are you paying attention to signs that the conversation or the questions might be triggering a trauma reaction? Are you tuning into that discomfort and confusion that the person might be displaying? Spending some time establishing rapport before diving right in can help. Allowing, pacing yourself, allowing for pauses, checking in every once in a while, how's it going for you so far, kind of thing. And also keeping in mind that it may not be accomplishable in one appointment. It may take having to reschedule with somebody and seeing them again. Encouraging them to bring in a support person who can help ground them. Those are just some of the kinds of things that you might think about when you step back and examine your process. So as you're doing all this work to create an atmosphere that creates safety for survivors, you may find that more survivors begin to disclose the domestic or sexual violence. So your agency should be ready to respond to survivors' safety needs. Emphasis on how this may look very different from program to program, because ideally not only is the safety focus tailored to your community and its resources and the survivors' needs, but those resources can differ from community to community. So it might look very different in a rural area versus an urban area, in tribal nations, et cetera, depending on what kinds of resources might be available. But we want to make sure that you're looking at how you can be ready to respond if danger it's indicated that the danger is current, that there are some immediate options for safety. Having that as part of your plan and your agency is really important. What would you do if the danger is current and very imminent? What are the options in that situation? But in all situations, if you get a yes to questions around disclosure of domestic or sexual violence, that really triggers your awareness that you should be doing an informed consent process as far as information sharing and disclosure, offering linkages to support services, priority placement, if at all possible in your community, and safety planning. But despite all that you can do to create an atmosphere of safety so that survivors can lower their guard and trust that they can disclose about violence in their lives, survivors may not open up about it right away. So we want you to know this kind of going in. They may have many reasons not to disclose, despite you doing everything that you can to create that great atmosphere of safety. These reasons could include having bad experiences with systems involvement before they stepped into your office. They already had some bad experiences and have trust issues around that. There are often fears that they could be denied services. Sometimes domestic violence survivors who disclose are sent over to the domestic violence system when what they really want is housing. So that could play in. There can be fears around immigration status and potential deportation if they're disclosive of what they're going through. There's also people who have lived experience with systemic racism in their lives and discrimination in their lives. And that can make for a situation of distrust and not feeling very open to sharing that private information because of those experiences and the context of their lives. There's sometimes this fear of potential child welfare and systems intervention if the abuse is discovered. Not wanting their child to be taken from them if they seek help for the domestic or sexual violence that they've experienced. And there are many, many more possible reasons that people might not disclose. So remembering that more may be revealed over time, and you might find that domestic and sexual violence is an issue after someone is in your program, after they are housed. And if that's the case, here are just some of the things that are important. Suspend judgment. Remember that there are lots of reasons that survivors may choose not to have disclosed earlier. And also, if they're co-housed with their abuser, they may choose to stay put and not leave the abuser. So that's an important thing to honor and work with if that's what you are dealing with a particular survivor. If you've had calls from neighbors, and that's how the domestic violence or sexual assault comes to your attention, it's really important to assure that you're going to follow up, but protect confidentiality. So you obviously are not going to go back to that neighbor and say, well, here's what we figured out. And also when you follow up, try to do that thing of having separate meetings with the couple. And of course, enacting your agency policy in concert with any legal protections. There's a whole slew of things that could come into play if somebody's already housed that provide protections for survivors under federal law, state law, and possibly local law in your community. If the abuse is uncovered and that results in the abuser leaving or being asked to leave the housing unit, helping them with a new placement is best practice, and also helping the survivor determine the best safety strategy from there. Okay, and so I'm not going to dive very deeply into the Violence Against Women Act today, but many people are very VAWA curious. So here's just a little bit of information, and now might be a good time to just present a very brief VAWA primer. VAWA definitely applies to somebody who is a survivor, actual or perceived, regardless of sex, gender identity, sexual orientation, disability, or age. It applies to dating violence, sexual assault, stalking, and it also kicks in through the funding sources that are passed through by the continuum of care. So this is, if that's you, this is a definite area that you'll need to develop more expertise around and have that information. So under VAWA, survivors have several rights, and here are some of the ones that are listed out on your slides. Being accepted into shelter housing, not being denied based on something having to do with the history of domestic violence, so criminal history or poor credit history. So you can't deny it because of the domestic violence. If the criminal history or poor credit history is connected with that. Removing the abuser, is one of the rights that survivors have if that's something that they choose. Porting the Section 8 housing voucher to another location, emergency transfers. Your COC should be having, if it's not already in place, a pretty detailed emergency transfer policy that you should be consulting. They also have the right, survivors do, to stay in the unit, and confidentiality of information. We've already touched on that some, but that's definitely a protection under VAWA. They also have the right to self-certify, and that's something I've discovered that some homeless and housing providers are not aware of, so that's something to follow up with your agency about as well. Okay, I know that was a real crash course, and I'm sorry about that, but we can definitely point you to more information about VAWA if that's something that you're interested in. Just let us know in the chat box, and we can do that. So we can't get too deep into the weeds with policies because policies across programs vary a whole lot. But some general rules of survivor-friendly and best practice policies are on this slide, and you can measure your policies against this. So safety planning at all stages of service delivery, not just at the front end or at one point in time. It's something that should be kind of infused in all your interactions with survivor households. Trying to really move towards voluntary services rather than mandated services, reducing those or eliminating them altogether to keep services low barrier. And building in tons of flexibility is very, very helpful for survivors. So you can tailor your response based on the survivor's circumstances. And we've also found that making sure your policies are in writing is really important so that staff have a place to go and consult, and that can also help take care of some of the turnover issues that many agencies have in nonprofits, in the nonprofit world. Okay. So we're wanting to avoid unintended consequences, and that means really looking at matching intent with impact, and some additional considerations as far as policy goes. Some of the big ones: never require a protection order as part of the services that you're providing for survivors. So it's not okay to say, we're going to put you in this housing unit or we're going to work with you, but since you're a survivor, you have to file a protection order as part of that. We know that the legal system involvement is not for everyone. Again, as I mentioned earlier, there are experiences with the systemic racism, the structural racism, fear of deportation, when the court system or law enforcement is involved. And it also may not really be protective for some survivors. It can serve to provoke the abuser when they are served with the protection order. It can anger them and provoke reassault instead of protection. So that's a really important, very individualized decision for each survivor. We also want to caution you to not bar the survivor from having contact with the abuser. Again, this might seem like a good idea, and it might be well-intentioned to have a guideline or a rule like that. But many survivors have required visitation, court-ordered visitation, just as one example, and have to participate with a child exchange for that reason, must see the abuser in doing that. They may be dependent on the abuser for child care or for money or for transportation. So having connection might be important just to be able to put one foot in front of the other and carry on from day to day. Sometimes having contact with the abuser may appease the abuser and diffuse the tension or the the buildup of that can lead to a reassault. And there's also some survivors that want to maintain a relationship with the abuser, but from a place of safety. So while safe in your services, they may be able to have contact with the abuser to help them with their decision-making process or some of the practical things that I named a minute ago. A third thing to not do is to expect the survivor to control an abuser's behavior. So if the abuser shows up at the apartment, not to assume that the survivor had anything to do with that choice, and to control the abuser's behavior once they are on site is an unrealistic expectation of survivors as well. So moving from the policy level, let's look at some further aspects of readiness to serve survivors effectively, including training and partnerships. So agency culture is that overarching atmosphere, the backdrop in which services happen. And it's really important that the whole agency is attuned to survivor safety, so that you don't just have some pockets of safety within or pockets of awareness about this within the agency. From reception staff to management and board, it's important for the agency culture to be imbued with a trauma-informed way of seeing the work and approaching service delivery. If just select staff are focused in on these issues, it's possible that they might not receive the overarching support that they need to really support survivors. So trauma-informed agency culture, really looking at the victim blaming and the different forms that can take, and getting that out of the agency culture. Having those active partnerships with content experts, and really expecting and supervising folks around this, supporting and expecting staff to adopt safety-related policies and practices so that it's in writing and it's also executed on the ground and there's accountability around it. Ensuring that staff have the tools and the confidence that they need to work safely and sensitively with survivors really does boil down to some fundamentals. Agency-wide training in domestic violence and sexual assault is core to survivor safety. That can really be key to getting rid of victim blaming when you really understand the dynamics. And so this is really key to housing retention as well. Agency-wide training in trauma, so that the trauma-informed approach is consistent throughout the agency, and then partnering. So that's just kind of a reiteration. And again, I've mentioned how important partnering is. I'm going to say it again. Even once all the building blocks are in place in your organization, an ongoing relationship with culturally specific organizations and victim service agencies is important. For one thing, they can help you bring in the training that you need and keep it fresh, so that it's really not just a one and done, keeping up with turnover, deepening understanding by having the trainers coming back more than just one time, so that can really reinforce and create the dialogue that's important across the systems. You can also establish agreements that you can call on each other to tap into each other's primary expertise. So that's another way that partnership can really be helpful in both of your systems. And there are co-location models, co-case management models that can work very well to really strengthen and enhance the partnership that you might have. So it's not just, yes, we know that agency over there and this is what they do, but you know the people that work there, you know what their expertise is, you bring it in and you do cross-training in order to promote everybody's ability to serve survivors. Domestic and sexual violence programs need help with housing expertise, so it's a really good cross-training opportunity. Other partners that may be helpful but are on this list. But this list can look very different, again, from community to community. Some of it you may need to be more reliant on state coalitions. Some of you may need to access national TA providers to bring in some of this. So communities have different abilities to have all these resources on hand. But again, as I've mentioned, not all of these resources, although it's a really kind of good list of things that might be helpful when you're working with survivors, not all of these resources are experienced as helpful by all survivors and have actually sometimes been re-traumatizing. So this list is not presented, I want to make sure you know, to convey that connection to all of them are standard for all survivors, but just kind of a soup to nuts list of the kinds of things that you might want to be aware of in your community, what resources are available. So now on to some nuts and bolts. With your victim-sensitive policy, attention to agency culture, and training all in place, let's move to a look at some basics about safety planning and practice. Keeping in mind that domestic and sexual violence are very complex issues, and that sometimes the wrong intervention can lead to harmful consequences. The underlying message here is don't wing it. Remember your experts. So making sure you have the information that you need or seeking that information in the moment if you need it so that you're not leading somebody in a wrong direction or intervening in a potentially harmful way, those unintended consequences that I mentioned a minute ago. So manuals and toolkits and webinars like this one are really no substitute for live interactive training. It's a really key ingredient to have this on a regular basis. Your local program or state domestic or sexual violence coalition can often help with this. Ensuring meaningful language access is critical. As you can imagine, if you were trying to have a conversation about domestic or sexual violence or doing safety planning and a conversation in a language that's not your first language, it could be very, very difficult. So extend that understanding within the way that you provide your services by developing a language access plan. And here's a resource that can help you start figuring that out. And again, remembering it's the survivor's plan and not your plan. So you may have some great ideas of what's kept other survivors safe or what might be good from your standpoint, but that may not be what the survivor sees as the best route for them. So honoring survivor preferences and, again, those cultural considerations is really important. And just to underscore the importance of being prepared to address cultural differences, here's just a brief snapshot of what we know about the composition of those experiencing homelessness today. And many of you may have come across the SPARK report, which is what this slide is drawn from. So the Center for Social Innovations, SPARK project, examined just a ton of information from 6 communities around the country and did oral histories and focus groups with people experiencing homelessness. And they found some just really alarming and important information for us to all bear in mind as we do this work, that more than 78% of the people experiencing homelessness were people of color. And when you look at the general population, the composition of the general population, which is 74% white and 12.4% black, 17.2% Latinx, that is a huge overrepresentation. With black people comprising 13% of the general population in the U.S. and 26% of those living in poverty, and yet more than 40% of the homeless population, Poverty rates alone don't explain the overrepresentation. There's a concept that Spark talks about called network impoverishment. You know, how we talk a lot about how the difference between being homeless, poor and homeless, and poor and housed is often that social network, people that you can go to for help. But if those folks don't have resources either, that's what we mean by network impoverishment. So poverty rates alone don't explain the overrepresentation, the systemic racism that compromises everyone's position in that community is a big part of what Spark is uncovering in this report. And the homelessness among American Indian and Alaskan Native people was 3 to 8 times higher than their representation in the general population. Now, what Spark found that what they weren't exactly looking for was that domestic violence was identified as a common thread in the lives of many of these folks that they spoke with. So we're going to be working together with Spark for us to center racial equity more in the work that we're doing and the trainings that we're doing, and they're going to be focusing more on domestic violence and what that means and the work that they're doing. And you can download that report once you have these slides by going to that link on the slide there. Okay. Review of our assumptions. We're proactive. We don't wait for somebody to tell us about domestic or sexual violence before we demonstrate that safety is key and very much a concern in our programs. There's solid training in place. Staff are confident that they know how to discuss and safety plan. You're very transparent with folks that you work with about data, what you have to collect, how you store it, and to talk about any options that are available. And you work to root out victim blaming and routinely applying a safety lens to survivor and survivor choice in decision making as you work with folks. There are some great safety planning tools out there. Your local program or state coalition probably has one that they could recommend. But remembering that your scope must be more limited than a domestic violence expert's scope. You're focusing in on working together safely. And really, more importantly, remembering that the best safety plan is an organic and conversation-based safety plan. So you might have a checklist, but it's the conversation around the checklist, around the items on the checklist that's most important. And again, a safety plan doesn't guarantee safety. It looks at how to reduce vulnerability and opportunity for the abusive person. Also, that safety planning really has to change oftentimes as circumstances change. So it's important not to have it be a one-time affair, but an ongoing focus. And also remembering that it's voluntary on the survivor's part. So they may choose not to enter into a safety planning conversation with you. Bringing the concept of safety into the room in your very first interaction is a very good practice to get engaged in as soon as possible. Opening questions like these can help gauge whether domestic or sexual violence or relationship dynamics may be an issue. And they can also send the message, as we're saying, that you are a person or an agency tuned into safety dynamics. So simple questions like, is this location safe for you where we're meeting right now? Are you safe to sit down and talk for a while? That might open the door to somebody telling you there's somebody waiting outside for them who's expecting them to hurry up and get you tuned into what might be the context of their life. Is there someone here today who makes you feel unsafe? And when we're finished talking, can you leave safely? Do we need to make some plans around that to ensure that you can? So when we're talking about safety planning, we're talking about survivor-led safety planning, but we're also looking at safety being defined by the survivor. The avenue to reducing risk is really highly individualized, and the survivor's ideas might look very different from what you might prescribe. So here's one example. Housing location is a key safety issue, but so is connection to community. And here in my hometown, Portland, as I'm sure as it's true in many of your communities, historically Black neighborhoods have become gentrified, and many people can no longer afford to live in them, in their once familiar neighborhoods. So finding ways to ensure that the new housing location doesn't cut them off from supports is as important as ensuring that the housing is safe and affordable. There are a number of different elements that come into play when that only the survivor can tell you about. So presuming things for folks is not helpful. Safety planning can actually be such an intuitive process to survivors that it might be tough to talk about, to kind of pull it out of the way they normally think about things and talk about it as a separate issue. So it's pretty woven into the way that survivors move through their days. But sometimes you can kick off a safety planning conversation by naming some examples you've heard. Again, remembering that these are not imperatives for every survivor, and survivors should always be asked, do you think that might work for you? So some of the elements of a safety plan might be staying connected with supports. How can that happen for the survivor that you're talking with? Rehearse the safety plan, taught children how to call for help, set up signals with neighbors, change daily routines. So these are some of the kinds of examples that might be included in a safety plan that can help trigger the conversation and set the stage for your talking about the particulars with that survivor. Remembering that survivors know a lot about how to survive is key, and you can show that you know that by partnering and pulling out some of these pieces. Restore a sense of control and efficacy by looking to the survivor as an expert. What are some of the things you've done to stay safe is a really helpful question, because that can do that thing of kind of pulling it out of the day-to-day existence and make it part of a planning process for a survivor. What are some of the things your partner has done that made you feel unsafe? What are some of the things that we need to have a plan for, kind of thing? And checking in about how it's working since they've been in your services, since you've been in our program, how safe have you been feeling? So keeping the conversation going. Safety planning, as we're saying, is tailored to the survivor and to their situation. Plans may look very different in different circumstances, and here are just some of them. Are there children in the household? That's pretty key. Children need to be included in the safety planning and provided for in the safety planning. The survivor circumstances are very different if they're separating from a partner. That might heighten the danger. Or if they're co-housed with a partner and that's their choice. They want to continue that living situation but want to talk about ways that they can feel safer within that situation. Are they living separately now? Does the abuser know where they live? Is their location, private from the abuser? All kinds of different elements might be included in a plan based on these different circumstances. And if the survivor is a survivor of non-intimate partner rape or sexual assault, the circumstances that they're focusing on in terms of their safety might be very different than in an ongoing domestic violence relationship. So thinking about the context is important. Connecting with survivors, not just about physical safety, but also about emotional safety is important as well. It really demonstrates when you can focus on this stuff too, that you have some grasp of the full scope of what they're dealing with. It's tough to deal with the emotional aspects, not just whether they can stay physically safe, but some of the things that might be triggering a trauma reaction, or the fear that they might be having to see somebody, see the abuser in a courtroom situation soon, that kind of thing. So asking about these aspects of safety should be part of safety planning as well, and not just how can you keep your body safe, but how can you keep your soul safe as well. So as we said, safety planning is voluntary for the survivor, but it really should be protocol for you. So it should be part of your work with everybody who's participating in your program. However, if the survivor chooses not to participate in a safety planning process, that's their right, of course. If they do decline, putting something out there, like offering a hotline number, or the referrals, or the invitation to come back and talk about that another time, just to make sure you keep that door open. It's important to ask if the survivors writing things down would be helpful. With the trauma impacts, including memory difficulties sometimes and confusion sometimes, having a safety plan in writing could be helpful. But if that is something the survivor wants, it's important to think about where it can be kept so it's not a safety risk, so that the abuser doesn't get their hands on it. And have the safety plan exposed. It's important to never put the details of a safety plan in client documentation. I just had a call about this the other day from someone. Should we be putting the safety plan in the client file? No. Those files can be subpoenaed and then discoverable to the abuser, and the plan may have to just be scrapped in favor of starting all over again. And that may seem like a remote possibility, but it's a very real possibility. So you, in the client documentation, probably want to include a note that safety planning took place and that you conducted that, but not the details of where the survivor is getting their support, who their safe people are, or even where you're meeting them for services, that kind of thing. Those can be too revealing and can compromise safety. Always offering connection to local domestic and sexual violence organizations and culturally specific resources is important. And keep that door open, because really trust takes a while to build. When you think about the people in your life that you have come to trust, you probably can look back and see that that's a process. So you hear some things that, sound good, and then if somebody's consistent over time and there for you over time, your trust begins to build. And this process may be really similar with participants that you're working with. So we hope that after today's webinar, you're going to be contacting your domestic and sexual violence organizations in your community, your culturally specific partners, and really try to take the next step with training so that you can better incorporate this ongoing dialogue about these issues within your own organization. We hope you'll also consider requesting technical assistance from either NASH or from one of our DVH TAC partners. Other resources that might be helpful, safehousingpartnerships.org. If you haven't already gone to this website, I really encourage you to go take a look at it. It's the website where the Domestic Violence and Housing TA Consortium has gathered together a slew of resources that we think are very helpful, trying to have them all in one place for communities that are looking at this intersection. So there's tons of data and lit reviews, evaluation, research, strategies, program models, stuff about the federal laws and regulations and policies that protect survivors when it comes to housing. And you can also request TA through that website. And the Domestic Violence and Housing TA Consortium is a really unique effort that was the brainstorm of 4 federal agencies who all partnered together to look at this intersection and see how they could pool resources to develop some nationally available technical assistance resources for communities. So the Family Violence Prevention and Services Program through HHS, the Office on Violence Against Women at DOJ, Office for Victims of Crime, also at DOJ, the Office of Special Needs Assistance Program, or SNAPS, at HUD, are those 4 federal agencies who are working together to make this consortium real. And the 4 technical assistance providers that this project has funded and supported are NASH, National Alliance for Safe Housing, Collaborative Solutions, which has been a HUD TA provider for a number of years and can really help make that bridge between domestic and sexual violence focused folks and housing-focused folks. The National Network to End Domestic Violence, which is a national resource center for DV that's been in place for some time and is a great convener, puller together of research and evaluation, and just chock full of wonderful expertise. And then the National Resource Center, or the National Network to End Domestic Violence, NNEDV, which is kind of the coalition of coalitions and has really their finger on the pulse of what's going on in communities around the country. And here's more about NASH's training and technical assistance. These are some of the many areas that we can potentially provide some help to you or your community. We provide systems level as well as program level technical assistance on coordinated entry, collaborations, trauma-informed practice, rapid rehousing, housing first, flexible funds, mobile advocacy, and then those federal, state, and local housing protections. And you can go to our website, which is listed here, to request technical assistance. So much of what we've talked about today, and I realize it's been really fast and kind of high-level overview stuff, although we did get into the weeds about some things, comes from the safety planning toolkit that you can find through going to this link. Safety Planning for Survivors of Domestic and Sexual Violence, a toolkit for homeless and housing programs. It came out a couple of months ago, and it's got extensive information that really amplifies this overview that we've talked about today. And then coming down the pike at some point soon will be a companion resource, Domestic and Sexual Violence Survivor Safety, Key Considerations for COCs and Coordinated Entry. So looking at the larger system issues and compliance with HUD requirements around safety planning is going to be covered in that document. So that will be a really good tool to supplement what we've talked about today. Okay, so we are at time for questions.
And we've had a few come in. And there's definitely space for people to type in more questions to the Q&A as things come up while Kris is answering some questions. The first question that we had come in today was from Michelle. She says, at their drop-in center, they have a few DV relationships where both partners can access their services. Sometimes both partners will be in the facility and they'll see a potential dangerous situation start to happen. What advice do you have on how to deal with that? In this case, it sounds like the victims are denying being in the DV relationship.
Okay, so there, it sounds like there's a sense that there could be some danger, but it's not being confirmed by what the participant is saying while they're there. Am I getting that right?
I believe so, but Michelle, feel free to jump in on the chat if you need to add any clarifying details.
Oh, she just said yes. Okay. Well, you know, that's a really that's a very tough situation. I'll just say that to start with, and you already know that, don't you, Michelle? I think that sometimes we want to jump in and intervene, but it's really not the right time to do that. That might be the situation where it would be really important to try to make sure that an invitation is put out there. If you'd like to call us at another time to talk about this again, or can we schedule another time for you to come in? If the situation has to do with the fact that the abuser is there with the participant, if you can separate them based on your protocol of interviewing separately, then that's great. And sometimes having it as a matter of protocol so that it's not just for you two, it's for everyone that comes in here. We have separate interview times so that everybody has the intake coordinator to themselves for a few minutes. So that protocol can sometimes help, but I think sometimes the only thing you can do is really try to diffuse the situation that might be kind of bubbling up on the premises, and make sure that you've done what you can to convey to the people that are there that you're happy to talk with them another time when tensions aren't so high. And I'm also, Michelle, as I say all this, really happy to have a phone call with you sometime to talk about this, because sometimes these really situational questions are difficult to dig into without a back and forth. So I think having separate space, if that's possible, is one of the best things that you can do, just in general. But sometimes if things are really bubbling up and it's just becoming a difficult situation for everybody who's in the building, sometimes just doing whatever you need to do when you're having those difficult encounters with people is what you need to do, and then try to keep the door open for ongoing contact.
And then our next question comes from Christopher. He wants to know if you could touch a little bit on services for males in a domestic violence situation. I think specifically around the safety planning.
Okay. Yeah, you've probably noticed that I stayed away from any gender pronouns when I went through all this material, because there's a full recognition that domestic and sexual violence can happen to men, women, and other genders. So it's really important that some of the same kinds of supports come through no matter who the survivor is. I do recognize, though, that in some communities, the services are still very much focused on women, and sometimes shelters, although I think they're changing throughout the country right now and need to be changing to meet civil rights obligations, are often still very focused on women and accommodating women and not men. So that can be a conversation that you might need to have with your local domestic and sexual violence provider to find out what they're doing to serve the needs of male survivors. But all the things that I said today about safety planning apply regardless of the gender of the survivor that you're working with. And again, I'm not sure if that touches on the particular element of your question that you wanted to get through. It's kind of a big area, and I'm also happy to have a separate phone call down the road with Christopher about that too.
And then our next question comes from Marlene. She asks, is there anything you think can be applied to an employment-based organization as opposed to a housing provider?
Employment-based, okay, so you're still having contact with people who may be surviving domestic or sexual violence, who are coming in for employment services and wanting to focus in on safety planning with them as well? Yes, I think that would be great to incorporate some of these elements, or at least the lens of recognizing that when people come in for employment assistance, there could be domestic violence or sexual violence as a in the context of their life, And so some of the same kinds of things, trying to have privacy, trying to make sure that you're communicating, that you're aware that some people that come and seek help may be experiencing those issues, and that you're certainly open to talking with folks if they want to share those things about their own lives. So yeah, I think I'd have to wrap my head around that a little bit more, how that might look different in an employment context or employment services context versus housing services. But yeah, I think that's a great thing to be thinking about, because many of the folks that are coming in are dealing with trauma or experiencing crisis, and potentially experiencing homelessness or domestic or sexual violence. So definitely that would be a wonderful thing to think about for your agency, how you can take these concepts and bring those in to the folks that you serve.
And then our next question is from Gladys, and the question is, what suggestions do you have to keep a transitional housing safe if a client with domestic violence does not have a restraining or protection order prior to entering the program?
Well, I think the relationship is really the best intervention. Having, building trust over time with the folks that you're working with, and making sure that you've established the basis for them to be able to share with you what's going on. And I'm not sure if in the transitional housing program, if that's a site-based program where, yeah, I guess I need to know more about that situation before I can kind of answer that. If it's scattered site transitional housing, and the person that you're working with has separated from their abuser and wants to stay safe without a protection order, I think that you do safety planning. You find out how they've stayed safe in the past, where are the places where the abuser might have opportunity to find them or mess with them in some way. The children, are they going to school? Does the abuser know where the school is? Those are some of the kinds of elements that you would just talk out with somebody in your transitional housing program. And you can also, as I've said, reach out to your domestic or sexual violence partners to see if connection to them might be something that the survivor might want, so that they can get into more depth with the kind of safety planning and other services and supports that they might need or want. Again, that's a situational question that might have elements to it that I didn't pick up on from the face of the question. So certainly can do a follow-up conversation with you as well.
All right, and then our next one comes from Magda. It's, what do you recommend in regards of transitional housing placement when most transitionals are at full capacity and the only transitional available is in the abuse area? In
the abuse area. I think that this is a situation, again, where it's actually a real thing that survivors sometimes live in the same communities or in the same neighborhoods as their abuser or the abuser's family or friends. And that is a choice that they can make, and you are there to provide support around how to make that the safest choice possible. So I think having a blanket rule that a survivor can't come to this shelter or live in this housing because the abuser is within a particular radius of that is something we really have to examine. And this is my opinion here, based on knowing that some survivors really want to stay in a familiar neighborhood, or they want to be housed, and if that's the only housing, they want to figure out how they can live in that housing as safely as possible. So I don't think you would just outright deny that survivor a unit in that transitional housing program based on where it's located and where the abuser is located. But it would be important to have a conversation with the survivor about how they see that being able to happen safely. And you'll often find one of my advocates used to say, be curious. You'll often find that if you ask a survivor, tell me more about how you see that working for you from a safety standpoint, they may have all kinds of ideas about how they can make that safe. And then you can build on that and work on fleshing out a plan together. So again, if I'm not getting the gist of the question and you want to have a follow-up conversation, I'm happy to do that with you as well, Magda.
And then we have 1 minute left, so we can try to go through one more question really speedily, and then whatever questions we don't get to, we'll let people follow up with through that evaluation. The next question, though, is from Rosa, and she asked, what suggestions do you have for protocol for an emergency shelter that serves couples?
Okay, protocol for emergency shelter that serves couples. I think one thing that you want to try to do is that separate intake or the upfront interview that you do with folks that come into shelter, so that people have a chance to say, I do want to be housed with this person I came in with, or no, I don't want to be housed with this person I came in with. So that would be one really important thing, even if your shelter does accommodate couples, to still make sure that that's everybody's choice to be housed that way. And if it is, then great. Again, you want to have the best intervention is a relationship, so you want to make sure that you've established as much trust and understanding from the gate that everybody being safe is important to your program. And then I think just being open to dealing with intervening if something comes up. And I'm kind of running out of suggestions here because, again, this is a situational. Often when people ask this kind of a question, something has happened that they really want to explore and see what they can do differently next time. And so, again, I'm happy to have a follow-up conversation with you.
All right, and we are out of time today. Thank you, Kris, for getting through so many of those questions, and to everybody for keeping it a really engaged conversation. Just as a reminder, we'll send out the recording of this presentation in the next day or so, along with a copy of the slides and some of the other resources that Kris mentioned. You'll get the evaluation link after you sign off today, but that'll also come to you in the follow-up resources. And through that link, you can request more TA. So if you have questions that didn't get answered or want a more in-depth conversation with Kris about something that we talked about today, that's a great place to request that. And thank you all once again for your time. Bye.
Thanks, everyone.